Hi guys, welcome to World Osteopathy Day. We brought the osteopathic team here at Physical Balance together. So we've got Andy, Alex, Caroline, Tasha and myself. Most of you should know us already. And we just want to introduce a little bit about osteopathy today and what we do and how we treat and our availability. So osteopathy is a manual therapy, similar to chiro, similar to physio. It's a common question we get asked, what's the difference? If I'm honest, I don't really know the answer. I don't know about you guys. We treat manually, so low back pain, joint pain, muscle pain, just generally quite a wide range of injuries. And there's lots of specialist interests in the room. We try and share the knowledge as much as possible between us. So yeah, that's what we're going to introduce you to a little bit today.
So yeah, it's really good to see how we can just break down a little bit some of the interests that we have in the room, like you say. So we thought we'd touch a little bit on sports injuries, headaches, mother and baby, and just general joint problems. And I know Andy, Alex and Joe, you're all kind of quite interested in the sports side of things.
Yeah, so my background, I was originally a sports therapist before becoming an osteopath. So I like sports injuries generally. I know that Alex, you've played rugby in your time, and Andy, you're particularly keen on runners. So the types of injuries that you see might vary a little bit. If you tell us a bit about the sorts of things.
Yeah, so I've been treating runners now for quite a few years, working alongside a PT and a running coach. So it's now obviously again a particularly sort of busy time of year for me, and then also treat usual sort of desk-based occupational kind of strains and injuries as well alongside that.
So quite a varied range.
Yeah, generally depending on also if they're more of a beginner level runner or more of a elite level runner. And also like maintenance treatments as well, just to make sure that they're actually still performing at their best and they're reaching the goals that they want to reach, not necessarily just sort of fixing actual injuries that have occurred.
And with sports injuries, this is where osteopathy sort of tails out a little bit, because you're going to give lots of rehab exercises and not just treatment.
Yeah. I think doing sort of additional kind of rehab work for runners is definitely something worth sort of looking at if that's something you want to kind of specialise in. Also very fortunate here to have Bridget, who's one of our sports therapists, and we have lots of other therapists here, which is great. So we can also ask those people questions as well, and just create an even better sort of treatment package all round, really.
Good.
I think sports injuries is often overlooked as something that osteopaths can help with. We get a reputation for backs, necks, headaches and things like that, and actually we know a lot about the whole body, so all joints, and actually sports injury is something we see a lot of and can make a difference, especially when we try and look a bit further away from the injury itself. If someone's got a knee problem, you always look above and below, which usually tends to make a big difference as well.
Yeah, good. Another area we look at a lot, we see a lot of this in clinic is headaches, and I know we sort of probably all see a bit of that. About 70% of headaches come from the neck, and it's it's an area that osteopathy can really help with. It's a particular area I love working on. Essentially different patterns of headaches. If you look back on a few of our blogs previously, and a few of our vlogs, we've talked about headache patterns, so maybe if you suffer that, you want to have a look at that. That's something that we treat a lot of. I know every one of us work with needles and also the manual therapy, like I said. Then another area, and this is not an area of mine, is mother and baby.
Yeah, so I think I've, with Carolyn and Steph, talked a little bit about women's health in the past, which encompasses the journey from getting pregnant, having the baby, and also afterwards. And I love that journey to treating a mother all the way through, from various aches and pains that arise during that time, and also being able to treat the baby if there are any problems at any stage. Obviously we like to do it in conjunction with the GP to make sure that there is good health, but I think it's a really interesting aspect of osteopathy. I know, Tash, sometimes you treat people with different pregnancy related conditions.
Yes, I think it's so important to keep mothers nice and comfortable throughout the pregnancy. I think there's so many changes that happen during pregnancy that it causes quite a lot of strain on the body, obviously. So it's definitely worth seeing an osteopath if you're getting all those aches and pains.
Yeah, good. And then generally, we talked about our specific areas of interest, but I think all of us like sort of across the board osteopathy. Yeah. I think all of us are interested in helping people. That's why we've come into this profession, and World Osteopathy Day kind of gives us a reason to celebrate that. We treat, as I said, joints, headaches, back pain, neck pain, shoulders. And although it's World Osteopathy Day, as I think Andy mentioned, we're in a multidisciplinary team. There's 13 therapists here at Physical Balance, including acupuncture, earwax removal, sports therapy, which tails really well into osteopathy. What else have I missed? Massage, foot health,
yeah.
And there's a few more exciting new therapies coming along. Watch this space. Now, 2 of us at least are in 6 days a week. So basically there's always at least 2 osteopaths in the clinic, Monday through to Saturday. And if you need an appointment, give the reception team a call or book online. And we look forward to seeing you soon.